One of the big issues that I see time and time again, it's people not understanding the nature of their injury and what it actually takes to heal. And when I say heal, that's a big spectrum. Healing could be a 20-something-year-old person who has a sprained ankle who needs, less than 2 weeks to come back from that sprained ankle, might still have a little residual pain. 4 or 5 weeks goes by and they're back at full function, especially if they've gotten some kind of treatment for the ankle. They're going to recover, near 100%, and they might not feel a single thing about that until 20 years down the line. Whereas somebody who's 45 and they're deadlifting at the gym feels a pop in their back, and they really are having a hard time with it, can't get out of bed in the morning, and they're wondering why it's taking 4 or 5 weeks to heal, on top of the fact that even when they go back to lift or feel some kind of function, it just is never the same. And that is exactly what I want to talk about today. Why are people not even understanding the nature of their injury, what they need to understand about the nature of their injury, and what it will take to heal or become stable? And those are two different things, but we'll talk about it right now. Number one, there's this word called fibrosis, which sometimes can be thought of as synonymous with scar tissue. It's not always true, but the scar tissue that develops due to an injury or recovering from surgery is because the body, meaning the musculoskeletal system or the cartilaginous parts of joints, or not joints, will also become damaged or have some kind of a trauma to it. And that is the scar tissue. Some people don't want to accept this as what's actually happening, but here's the reality. You have different measures, you have different layers of scar tissue. So what can happen is type 1 fibrotic type injury on the sort of surface level of even the discs, but the very, very, very outer portion of the annular fibers, not even the full annular fibers of the disc within the spine, when you might feel a pop at the gym. But you can have something on your bicep or your tricep, your leg, your quad, your ankle, your calf, and those types of surface level musculoskeletal, or I should really just call them musculotendinous or even sometimes ligamentous injuries, depending on your age, when they get a deep enough injury, they can heal. They still get blood supply. They still will get a good outcome when you do things like soft tissue, cupping, massage, microneedling, rich plasma, So when you do things like that, you can actually have a good outcome a majority of the time. But when you actually end up hurting your intra-articular cartilage, so that's the deep joint cartilage, deep within the elbow, deep within the shoulder capsule, deep within the hip, you might hear about like a labral tear. When you do things where you're injuring yourself on the deep intra-articular cartilage, those are not blood flow well received areas of the body. And those have very poor healing quality, to the point that I would go as far to say as almost zero. Yes, that's right, you heard me, almost zero. Why? Because I have my years in clinical practice to see the people I've been working with and their outcomes. And I personally, with my lower back injuries of my L4, L5, L5S1 injuries, the most common type of lower back injuries that you will see when it comes to discogenic or disc-related micro tears or macro tears of the disc that then lead to things like herniations, which then lead to different levels of stenosis or narrowing of the spine. Those are my areas of expertise. I see many, many cases like this, and people think that they are just going to come in like they're 25 years old, get adjusted, get different modalities, and be better. So here's fact number one. Fact number one to these intra-articular injuries that do not heal well at all, sometimes not at all without surgical intervention, and even then, not only will they not potentially heal because of more scar tissue, but they might actually take away one symptom, which makes your quality of life better, but give you different kind of pains or different kind of symptoms. You have to be aware of this, and you should know the truth. So the reality is, when those types of injuries happen, they do not heal fast, and oftentimes the best way to treat them is with ice and rest. That pause was on purpose. I just said it. Ice and rest. You're going to do more for your back by getting a nice cold bag of vegetables and putting it right there, sitting on your absolute most comfortable chair, usually a soft surface, not a hard surface. That should make sense. The harder surface, when you just go with the laws of physics and the way that gravity isn't working for you there, and this return sort of force or energy up through the spine, for the same reason people say not to run on concrete, that can actually hurt your back when it comes to back pain. The same thing for your knee, the same thing for your shoulder. It's ice and rest. And ice should never be more than 10 minutes where it's spot ice. And if you're going to submerge yourself in a cold plunge, I would say never do more than 90 seconds. One thing you have to understand about ice when you're compressing and the vasculature is restricting, it's restricting to a point, but the body is smart, not stupid. And after that constriction for a little bit, it will actually want to open up. If you do full-blown submersion, your body will be forced to open up vessels. If not, you'll probably have some amount of a spectrum on the spectrum of cardiac arrest. Very dangerous. That is why you hear a lot of horror stories, if you really look deep into it, about people who tried to do ice plunges, who went into freezing cold water, who went into cryotherapy and had a bad outcome. It was because they didn't realize just how dangerous it was, and they probably stayed in for far too long. But I digress, and we're going back to the second phase of what I want to talk about, or things to understand when it comes to these injuries. Say you have a hip injury or a knee injury, and that intra-articular cartilage and intra-articular capsules have been damaged and can't be healed. What will work, and what will happen, and what will be the outcome? Well, here's the reality. Things like PRP won't work because they can't give you enough of a blood supply to a deep enough level of that injury. But will shockwave potentially work? And not because I have a shockwave machine. The answer is shockwave will be a good temporary sort of stimulus that the body will respond to in a positive outcome if it's done correctly because of how deep the penetration can be. It's not just bringing healing to the tissue. It's actually likely not bringing any healing to the tissue. What it's doing, much like a great chiropractic adjustment, is the stimulus is inhibiting the pain pattern through microcavitations. That's right. The fluid actually being pushed back into the joint to lubricate it, if you will, as the gas bubbles, cavitate and leave the joint. And that is how shockwave or chiropractic would work to help manage and reduce symptomology so you can have a much better quality of life. Which brings me to my last point. Is it possible to heal when you have these intra-articular, deep, chronic injuries that always seem to come up? Everyone has like their spot. A lot of people with neck injuries, with terrible radicular pain, will have their spot there that they think is a trigger point. People like me, they have their spot, here or here or here. And it's just sort of all the time. However, with a lot of good, timely treatment, it can be reduced to almost nothing. That is the actual fact. And then you're out there trying to run marathons and you wonder why your pain comes back. I know I've gone on for a little while here today, but I hope I ended up breaking down the difference between a surface level, scar tissue forming young person's or older musculoskeletal injury with a type 1 type of fibrotic tissue that can actually heal versus the deeper intra-articular type of injury that does not have the same type of healing properties, thus creating a scar tissue that is much more likely to stick around and be much more detriment to your health. And a lot of us with chronic injuries need to be able to understand it. I keep saying that in my videos. We need to be able to accept it so that we can seek out the best treatment where usually less is more on the stimulus, so our bodies can recognize a way to try to inhibit and heal and have the best quality of life moving forward without having unrealistic expectations, blowing tons of money, wasting tons of time, and being in even more pain. All right, if you need anything, feel free to drop something in the comments, reach out, whatever you need, we're here for you. It's Dr. Pearlman.